Executive Director. Hi, my name is Mason Davis. I'm the Executive Director of Funders Concerned About AIDS, and I am honored to welcome everybody today, both in person here and online, to the launch of our 21st edition of the Resource Tracking Report, Philanthropy's Response to HIV and AIDS, this year on 2022 grant making. Through research, advocacy, and opportunities for collaboration, FCAA works to help mobilize and grow funding for our ever-changing fight against HIV. Our global network of members and partners represent the majority of private sector HIV-related grant making today, providing critical support for the people and the places most impacted by the epidemic. And you're going to hear today about our signature piece of research, this annual publication that maps philanthropic funding to help the sector identify gaps, trends, and opportunities in grant making to build a more comprehensive philanthropic response. Now, today's report, though, is being released against a backdrop of an increasingly difficult global environment. It's kind of striking to me that we actually know how to end AIDS as a public health challenge today, and yet we are lacking the financial resources and the political will to do so. We really see political will faltering globally and in so many parts of the world. Just today, some of you may have seen this morning, UNAIDS reported that domestic resources for the HIV response declined for the 4th year in a row, and support from donor governments outside of the United States was down by 61%. At this point, 58% of all global HIV international assistance, including public funding, is coming from the United States government, where a few things are going on these days. We are concerned that we are seeing HIV as an issue, HIV funding, increasingly politicized, not just in the United States, but in many countries around the world. Meanwhile, while HIV rates continue to rise in many of the parts of the world, including Eastern Europe and Central Asia, Latin America, the Middle East and North Africa, political attacks, especially against LGBT communities, are increasing around the globe, which is complicating the HIV prevention and treatment responses for one of the communities most at need. In fact, today's UNAIDS report shows that prevention is only reaching about half of people from key populations being gay men, trans people, sex workers, people who use drugs, and others most impacted. Without access to prevention, new infections will continue to increase among key populations and their partners, who we know account for 55% of new infections globally and upwards of 80% outside of sub-Saharan Africa. Yet UNAIDS estimates that only 2.6% of total HIV spending goes to key populations. So we know that private sector philanthropy is a critical part of the HIV response, especially for supporting marginalized and criminalized populations that oftentimes fall through the cracks of government. And we also have a critical role to play in funding advocacy to leverage and push for more resources. So that's why we're very excited to be able to launch the report here at the International AIDS Conference, so we can hopefully bring this research and information on private philanthropic funding into larger conversations happening this week and explore how we can better resource the HIV response together. So let's look at what the report says. I'd like to introduce Kat Geranda, our Director of Research at FCAA, up here to share the findings with you today and give us some more insights on what the research finds. And then we're going to hear from 3 donors in the response who will share their perspectives, and we'll have some Q&A as well. For those who are online, you can also put any questions or comments in the chat, and we will respond to those later. So with that, I'd like to introduce Kat to share some of the finding reports.
Thank you, Mason, and thank you everybody for being here. I know there's a lot of competing priorities today and a lot of really important content happening. I think that's why we're really excited to launch at the International AIDS Conference, and I'm pretty sure this is the first time we've ever been able to produce the report in conjunction and launch at the same time. To be in conversation with the data that Mason is talking about coming from UNAIDS this morning, and to really think about the critical response that philanthropy plays and the role that philanthropy plays in these conversations is part of why we want to be here and share this data. So the report this year, Philanthropy's Response to HIV and AIDS 2022 Grant Making, it is a new title for those of you who've been tracking. And it's also, you're going to find a much shorter report. Part of that is that we are moving to get our data out more quickly. So you're going to find our 2023 report coming out just shortly after this so that we can be as up to date as possible in having folks understand what the response is. So excited to share with you today a little bit more from our findings. That's our fancy cover. And yeah, you can go on to the next slide. So 659 million in HIV-related philanthropy we tracked in 2022. That is coming from 767 funders in the form of 6,300 grants and going to about 2,700 grantee organizations. Last year, we tracked about $703 million in funding. So you'll see that this year, we're actually looking at a 6% decline in funding. And that's something we really want to flag. We've been sounding the alarm for the last few years, knowing that there are funders moving away from the field, that there are some longtime funders that have been diminishing and pulling back. And so we are really seeing the evidence of that in this year's report with this decline, especially as Mason outlined, in a moment where there's some serious challenges and a lack of political will around the world right now. So a concerning decline for us. A little bit on the top 20 grant makers this year. I'll spend a bit more on this list because we saw some changes that are worth noting this year. The top 2 funders, the Bill and Melinda Gates Foundation and Gilead Sciences, again, in those spots, they've swapped back and forth a bit, but we saw declines from both of them, just a 4% decline from Gates Foundation, a 26% decline from Gilead. There's a note in our report that that they've identified that that's not a move away from the field, that that's just a fluctuation in disbursements. We've seen some more declines from other funders as well. Notably, 9 out of the top 20 showed declines in 2022. Notably, we see Mac Viva Glam, a longtime HIV funder, with a 48% decline. They've been really moving down over the years. And that's one of those areas of concern. You'll notice that Open Society Foundations, for the first time in 21 years, is not on this top 20 list. And we saw Ford drop off a few years ago. So again, some of these funders that we know have been really vital to the response over the years, we're seeing declines from. We are seeing some bright spots, though. We saw increases from a number of funders. And Vive Healthcare with a significant 16%, Elton John AIDS Foundation up 26%, AIDS Funds up, UHI notably with a 74% increase. They came onto the top 20 list last year around the 19th or 20th spot and moved up to number 12. They're an intersectional participatory grant-making LGBTQ organization based in Eastern and Southern Africa. So excited to see that there. And we've seen another pool of intersectional funders really coming onto the top 20 list right now. So the Arcus Foundation, Wellspring, the Pritzker Family Foundation, which is based in the US and the Midwest, we really saw rise up with some reproductive health and HIV prevention intersectional funding, and yield giving for the first time on our list, mostly because it was the first year we were able to track data from, that's Mackenzie Scott's fund, and we know that there was more funding that we didn't have the available data for on from yield giving as well. So excited to see some of these intersectional funders coming into the conversation, understanding that relevance, and we're going to hear more from our speakers a little bit about that as well. And then also just to flag some longtime HIV funders that have been staying with us in the field, right? Stephen Lewis Foundation up there, AIDS Funds, Broadway Cares, Elton John, so a number of funders that we know have been with us, Sidaction, and continue to stay strong. But just wanted to kind of walk through some of that. And also, we're seeing a pretty serious concentration of funding. It's something we talk about a lot, but we see that the top 5 funders are responsible for a little over 70% of funding. And then the top 20 funders, over 84% of funding coming from the top 20 alone. But also really important to flag all of those funders. I think we continue to stress the importance of including funders that make 1 or 2 grants or make a series of small grants and the value that they place on the local communities that they are reaching. So we're always inclusive of that. You'll see that total number of funders kind of fluctuate up and down based off of some available data, but always valuable to include all of those funders for us. Next slide, you'll see just how the funding is reaching different populations. This is just a handful of the full list of populations that you'll find in the report. You can see at the number 3 slot, women and girls, we know 53% of people living with HIV in the world. We saw a 45% decline in funding for women and girls in 2022. And they're still at the number 3 spot, but we know that that's a significant drop. It's actually the lowest number in 6 years that we've seen for women and girls. Youth saw 35% decline as well. And key populations saw a small 4% increase, but many of the individual key populations actually saw declines. So funding for men who have sex with men, gay men, down 18%. Funding for people who use drugs down 18%, funding for sex workers down 13%. We did see increases to funding for trans communities up 5%, and the LGBTQ general population, where funders haven't specified a subpopulation, saw a 9% increase in funding. But always something we want to flag, as Mason said earlier, funding for key populations, specifically from philanthropy, is vital, as that's a space that we know that populations that are being criminalized by their governments are not going to receive public funding dollars. So a really important space for philanthropy to step into. We also track the intended use or the strategy of funding. That top bar is a sort of conglomeration of 3 categories that fall under the services. So we're looking at prevention, treatment, and social services, which is a large portion of philanthropic funding going to those 3 areas. But notably, funding for advocacy, we saw rising over the past few years steadily. And this year we saw it kind of stagnate, or a slight 2% decline. So another area that we know philanthropy is really vital in funding, leveraging those philanthropic dollars. It's not a big portion of the overall resources for HIV communities, but we know that advocacy funding is really important for leveraging public funding dollars and for supporting communities that are being criminalized and so forth. So always something we want to flag there. We also have a breakdown of funding by global regions that you'll see in our report. This is kind of a legend of some of the items that we include before I dive into it, but we're looking for each global region at total philanthropic funding. Also, UNAIDS data looking at number of people living with HIV, number of new infections and AIDS-related deaths in each region, and the percentage number there is whether it's increased or decreased from the previous year. And then we've done some rough math to understand how many philanthropic dollars are reaching each person living with HIV per global region. So when we dive into this, you'll see that if you were to sort of distribute that funding globally to the 39 million people living with HIV, we're approximating $17 per person living with HIV. But in reality, that funding distribution, when we look at Western and Central Europe and North America, predominantly that funding is going to the United States. We see it comes out to about $119 per person living with HIV. And then looking at other regions like Asia and the Pacific or Latin America, that breaks down to $2 per person living with HIV. So we understand that there's really a disproportionate distribution of that funding. Looking at some of the other global regions as well, you'll see that there it is. You'll see that we're approximating around $7, $8, $9 per person living with HIV, 13 in Western and Central Africa, where we did see a significant 69 increase in funding there. But notable here, as Mason mentioned, Latin America, the Middle East and North Africa, Eastern Europe and Central Asia, regions where we're all seeing new infections rise around the globe. So areas that we know we need to focus on. We did see a 13% increase in funding to Eastern Europe and Central Asia in 2022, and notably a 500% increase in funding to Ukraine specifically. And that's the first year that we're tracking funding after the Russian invasion and the full-scale war began. And we'll hear a little bit from our speakers later about our Eastern Europe and Central Asia Working Group and some of the efforts that funders have been doing to come together in collaboration and conversation to really move funding dollars. And it seems like that's been really effective. On the next slide, we'll see, this is just another thing in the report. I won't dive into it, but we have the top 5 funders per global region listed. We also have top funder spotlights looking at different populations and different strategies. We've taken a different approach this year where we're looking at still the top 10 funders for each issue area by total US dollars dispersed, but we've listed them a little different by looking at the percentage of their total funding for that issue area. So the percentage of their total HIV granting for that issue area. So for example, like the top funder listed for women and girls is the African Women's Development Fund, because 100% of their funds reach that population. And again, for sex workers, we have Red Umbrella Fund listed at the top, even though by rank, they're the number 2 funder. And again, gay and bisexual men, other men who have sex with men, we have Impact Global Action as the top funder with 100% of their funding, but they're really ranked at the number 5 funder. just so you get a sense of how that works. But just really trying to focus and lift up some funders who may not be dispersing the largest pool of funding, but we know are wholeheartedly focused on that issue area or that population or that community. So something I wanted to flag there. I'm just going to wrap up and give you a little quick summary. 6% decline in total funding, something that we're really flagging as a concern. We see some longtime funders moving away from the field, but we do see some intersectional funders that are coming onto the top funder list, which is really important. There's that continued concentration of funding, but we are seeing more diversity in that group as well. We know that funding decreased disproportionately for disproportionately impacted populations. So women and girls, youth, men who have sex with men, sex workers, people who use drugs. We have seen funding for trans and LGBTQ general communities increase, but we know we need more with the anti-gender attacks that are happening around the globe for those communities. We saw a slight decline in funding for advocacy rather than that upward trajectory that we want to continue seeing from philanthropy. We have an understanding that the funding is not disproportionately represented around the globe. And we have a bright spot of that 500% increase in funding to Ukraine in response to the war. And with that, we know that collaborative efforts like the Eastern Europe and Central Asia Working Group can mobilize funds and have an important impact. So I'm going to stop there so we can bring our speakers up. I'll pass it back to Mason for those introductions.
I would just like to take a moment to thank Kat for all of her work on this report. If you can imagine how many grants she reviews each year to understand what's going on, to document this, get it out as quickly as possible so you all can use it in the field. So if you could just join me in a round of applause for her. Pat mentioned one of the bright spots is the fact that we know that when funders organize and come together, they actually can make measurable change. And we would like to invite Mark Vermeulen from AIDS Funds in the Netherlands, who also serves as the vice chair of FCAA's board director, to come tell us a little bit about how that work has been possible.
Thank you, Mason. And just again, Kat, it's really amazing what you're able to do and take us through all these numbers so quickly and elegantly. Thanks. It's good to be here. And like you mentioned, Mason and Kat, we wanted to highlight a few things. One of the things is what is happening in Ukraine and Eastern Europe, Central Asia. And to start off, I think it feels difficult to call it a bright spot with everything that's happening in the Ukraine, the full-scale invasion, the struggle we see with our communities there. So I just want to acknowledge the atrocities, but also the hard work of all those people on the ground, pushing back, doing what they can. And at the same time, and I see colleagues from the region here as well. So thank you for your work there. And at the same time, also good to see at least that under these circumstances, funding to Ukraine went up so dramatically, and rightly so. And we also probably know that it's still not enough, and sort of a trickle-down effect to the rest of the region. And in just a few minutes, I want to share with you what we think at least are a few of the lessons, if you may, that we can draw from this horrible situation. And I just want to take you through the three things that we think stand out, at least from AIDS Fund's perspective and working with our partners. I think, first of all, what was mentioned is the funders' concern about AIDS, bringing together different funders in what we call the Eastern Europe, Central Asia Working Group. I think the first lesson is that we started this working group actually before the war broke out. And that allowed us to work together to get an understanding of what different funders were actually doing in the region, to build trust, to learn about each other's interventions. And when finally the war broke out, we were actually able to move quite quickly because we knew who was active in the region. We knew from each other who was doing what, and probably not a complete overview of everything and everyone active in the region, but at least we knew where to start and who to call. And FCAA was brilliant in facilitating that before the war broke out, identifying the region as something that we've seen as one of the two regions in the world where HIV infections are still dramatically increasing, to bring us together as funders. And that really allowed us to move quite quickly once the war broke out. A second lesson that we've seen there, and we just earlier in this room, we were doing the replenishment of the Robert Carr Fund, which is a pooled funding mechanism, is also that here a pooling of funding from different donors has been tremendously helpful. I think we were in a panel yesterday with Anne was there as well, Meg was in the room, where we see that we're trying to do a lot of emergency response funding, which is crucial for communities on the ground. It's a lifeline. And at the same time, if we pool our funding also in emergency situations, there's a lot to be gained there. I think what we've seen by pooling together the funding from different donors as AIDS funds, we were able to move quite quickly with our own unrestricted funding to reach out to other donors to not set up their own emergency fund, but to pool it together. And making it a lot easier for people on the ground to access that funding. So not to figure out who's doing an emergency response thing for what, how to access it, how to apply for different application forms, but really to pool our funding together, present ourselves as funders committed to what's happening there, and to basically provide better support, be able to move more quickly and address the needs of those communities on the ground. Third point, final point, what we've seen happening over the course of that year is that we've moved to become more of a participatory fund, to work towards a participatory funding mechanism. So in that setting up of the emergency support fund, we've moved with local partners already working in the past, working with them to also do part of the funding decisions, and to make sure that the funding decisions at a smaller amount are made as close as possible to the organizations doing the work. So by training our local partners to take over part of that that funding, the funding decisions, we're now able to move even more quickly, have a better understanding of what the need is on the ground, and empower our local partners to look at the funding requests that come in and decide by themselves what to fund, who to fund, and to move again more quickly in this crisis situation. So with that, I'd like to close. I really want to thank FCAA for collecting this data, because it's really helping us to have an understanding of who's in the region, where the funding is going, and it empowers our and strengthens our decision making. We've seen that increase, and I just want to highlight that we also know at the same time that in the region, still of all this funding, only 5 to 10% of that funding is going to community-led organizations. And that also possibly means that only that amount of funding is going to, for example, key populations that are most affected. So also here, despite the fact that we're seeing that increase, I think as donors, we really have to look at not only increasing the amount of funding, but also really tracking where is the funding going? Are we reaching those communities most in need? And also reaching out to donors outside of our realm of HIV in the broader humanitarian response, to also make them aware that even in these situations, there's those most marginalized, like people using drugs, LGBTI people, trans people, that are not being reached if you don't pay special attention there. So with that, I'd like to close. Thank you again to the FCAA team. And these are just a few of our lessons, but really eager to seeing a lot of people in the room working in the region as well, to talk to you afterwards, to see what you have learned, and possibly we've missed a lot of lessons here as well. So please reach out after this. Thank you.
Thank you so much, Mark, and AIDS funds, and I think also Gilead and Elton John AIDS Foundation, and many of those that have really invested heavily in Eastern Europe and Central Asia to try to help what's been a very difficult time. And I think Yulia and Afu and so many of the different groups that have been working together to make that possible. One of the things we believe really strongly is that HIV is a human rights issue, and human rights is an HIV issue. And we have been really intentional in working with intersectional donors and human rights donors to help understand and draw out the connections between HIV, healthcare, and human rights. And we're really delighted to see some increasing number of human rights funders showing up as well as HIV donors these days. And with that, we'd like to invite Ali Jurno, the Vice President of the Social Justice Program at the Arcus Foundation, to kind of come on up and share how they are looking at this as they have become increasingly aware of the connections between HIV and human rights. Ali.
everybody. Thank you, Mason, and thanks, Kat, for that amazing, very clear presentation of a huge amount of very important data. And thank you, Mark, for those really encouraging examples. So as Mason said, Arcus is a private foundation. We've been around for about 25 years. We're focused on LGBTQ human rights. We support advocacy organizations with long-term, flexible, general operating support. And we firmly believe that we need to support the advocacy that changes the conditions that drive this epidemic. So I'm going to give you 3 reasons why HIV has to matter to LGBTQ human rights funders. I'm going to begin with the stats, because we just had a presentation on the stats, but these are slightly different stats. As Kat said, 39 million people living with HIV. Key populations are 70% of that number. The infection rate among gay men is 11%, the general population, 11 times higher than the general population. The infection rate among trans people is 14 times higher than the general population. And the HIV prevalence among MSM in countries that criminalize identities is 25 times higher than the general population. So stats alone, that's reason number 1. Sit with those stats for a minute. Second, the history. Okay, as I said, Arcus Foundation is based in the US. It has grant-making programs in the US and outside the US. And in the US, going back a couple decades, there's been a long-standing bifurcation between HIV work and LGBTQ advocacy, despite, ACT UP, despite the history of HIV activism in queer movements. Within LGBTQ philanthropy, we kept telling ourselves that we funded advocacy and not services, and that this was human rights and not health. But even though the funding streams got split like that, with health on one side and human rights on the other side, that dichotomy was just false. And it didn't make sense in people's lives. I just want to recognize that, and I want to acknowledge philanthropy's own siloization of that issue. So in the US, you probably know this, but the epicenter of the epidemic is the American South. The American South consists of a bunch of states that have historically and unintentionally underinvested in public health infrastructure. The highest rates of new infection are among gay and bisexual men and trans women. Okay, Black Americans, who are 12% of the US population, are 40% of those living with HIV. These numbers tell you that racism, homophobia, transphobia, and poverty continue to fuel this epidemic. This is the region with the highest rates of new infection. So you can't be concerned about inequality without being concerned about HIV. And our grantees know this because they work with and are led by those who are most at risk, who are most vulnerable. And they are demanding better access to services. They understand that health for people living with and vulnerable to HIV is not just about service delivery, but is actually a demand for justice. And that's what they're engaged in the advocacy to do. So that's my second reason. That's the history. The third reason is, what are our Arcus's grantee partners doing with the possibilities that HIV advocacy affords? So bear with me for a moment. Arcus funds in the US, as I said, as well as in Mexico, the Caribbean, Central America, and East and Southern Africa. So in many of the countries where we fund, the LGBTQ organizations and the HIV organizations are one and the same. They're the same people, the same activists, the same fight, right? Our grantees in East and Southern Africa are advocating, litigating, organizing, and running clinics, offering testing, offering counseling services, right? They are challenging the laws that criminalize same-sex sexual conduct, which has had such a devastating impact, as we know. And as we also know, those laws are on the rise, which is very, very alarming. Arcus grantee partners have used the opportunities for HIV advocacy to show up and engage with government agencies, government ministers, members of parliament, and they are seen as stakeholders and they're demanding a seat at the table. So an activist in Kenya, a brilliant activist, explained to me that she's always asks, what's my entry point for advocacy, right? And for her, the entry point for advocacy for her organization, it was the National AIDS Country Operation Plan. And she said, this is where we're going to enter. This is where we're going to make the relationships. This is where we're going to show up and be heard. They ended up developing really close working relationships with the health commissioners in all 47 counties in Kenya, right? They attended all the meetings. They shaped the government response. They forged relationships. So this was HIV advocacy, right? It's participating in the advocacy that shapes the national agenda and the priorities. But what it also means is that they have created that web of allies and supporters inside and outside government across the country. And that matters not just on HIV, but in all their efforts to combat stigma and discrimination and the right to be heard as queer and trans Kenyans. So those are my 3 reasons why ARCIS sees itself as an HIV funder. And I think all sort of LGBTQ advocacy funders should see themselves as HIV funders as well. And of course, HIV funders are part of this human rights battle. Thank you very much. I'm going to turn it back over.
I want to tape that and play it for human rights donors all over the world, Ali. That was wonderful. Thank you so much for such a clear explanation of the connection. I also, our final speaker before we open up for some questions is Jesse Milan Jr. While Arcus and Ali are in the top 20 for the first time, Jesse, as the president and CEO of AIDS United in the US, has been in this for a long time as an HIV donor and is also chair of our board at FCAA. Jesse, would love to hear from you as you close this out today.
Thank you so much, Mason. And special congratulations and thank you to Kat. What a magnificent piece of work you've done. That research is really important. And as chair of the board of FCAA and as CEO at AIDS United, I am thrilled that AIDS United is a part of it. But I want you to know how important this work is. This work is important because it says to not just the philanthropic sector, it says to the governmental sector and to all of us in NGOs what is needed for ending this epidemic. We've known since the very beginning that no one sector can end this alone. Not our federal governments, not our state governments, and not NGOs working with individual donors. But we need a multi-sectoral approach. And this approach is one that is documented so well by this report. And I'm very proud that AIDS United is included in it, but I want to share with you that I'm also a person living with HIV. And from my perspective, not just as a donor and as an organization that receives funds from many of these organizations, as a person living with HIV, I see some very exciting news in this, but also some very alarming news. And as Ali did, I think there may be 3 perspectives that I want to share. First, some good news. Hidden inside this report is an indication that funders are making a structural change. They are starting to improve and increase their percentage of support through general operating funds. Now, for those of us who run organizations, we know that general operating funds are the lifeblood of our organizations. So many times the funds that we get from federal sources or from government sources does not provide all that's necessary for us to actually do the work that the government asks us to do. So we need general operating funds to augment those supports. But general operating funds also make it possible for us to be nimble, to respond to the immediate needs in our community, and to be creative in creating innovative structures that funders, whether they're government or donors, are not yet ready to support. And so general operating funds make a huge difference. They make a difference, especially in these last few years, as so many NGOs have been struggling to survive in this political environment and in this economic environment where COVID-19 has devastated so much of our funding and where our organizations and our people are suffering under their own economic and political vestiges. So we have so much to be grateful for a change toward more general operating support. And for all of us who are NGOs, we know how important those are. But second, what really concerns me is something that Ali has already started to share with us, and that the report shows that there is a noticeable decline in philanthropic support for policy and advocacy. So let's be very clear, as Ali has made very clear, around the world, policy and political issues are making it very hard for people living with HIV and for people who are vulnerable to HIV to know their status and to get in to stay into care. If you live in an environment where anti-LGBT laws are increasing, why do you want to know your HIV status? If you live in an environment where stigma and discrimination still exist, or where criminalization laws still exist, why do you want to know your HIV status? The frightening aspect of knowing your status. And the problem that so often happens is that the economy and these political issues are making it even harder for people to stay in care. We need to do all that we can to advocate and to educate our decision makers on what is truly needed for ending this epidemic. That's why it's important that we bring the voices of people living with HIV and vulnerable HIV directly to decision makers so that they can be educated on what is needed for ending this epidemic. And that education needs to happen not only with Congresses and parliaments, it needs to happen at regional and local levels as well. And it needs to happen with presidential palaces. It needs to happen with ministries of health, with ministries of education and labor and justice and on to help them understand they are all part of the solution for ending this epidemic. They need not be part of the problem. And perhaps I think the biggest story of this report is that this is the 21st year that FCAA has documented what's going on in the philanthropic arena. 21 years of sustained support. But will it continue? With the precipitous decline that we've just seen in the last 2 years that Kat has made very clear, a 6% decrease is one that we should be concerned about. And why should we be concerned? Well, every day, someone new learns their HIV status, and they begin a lifelong journey. I'm living with HIV for some 40 years. I expect to be around for another couple of decades. And I may need governmental and philanthropic support in order to help me get to that end. Every day, someone new makes their sexual debut. Every day, someone new experiments with a substance that they might become addicted to. And every day, someone new learns that PrEP might be a solution for them. Are they a single data point in 1 year? No. They too may need sustained support over their lifetime. And so I want to challenge all of us who are donors to continue to do the work that we've been doing. I want to challenge all of us who are concerned about HIV/AIDS to encourage more donors to join this cause. People like me will need your support for years. You are in this room at this conference, and we're doing this work at grassroots level to make it possible for us to get to those goals, 95, but let's not leave anyone behind. We won't leave anyone behind if we're all behind the common goal of ending this epidemic so that no one ever again has a transmission of HIV, no one ever again has a diagnosis or dies of AIDS. Let's do that work together. Thank you. Blessing.
I wanted to open it up if there are any questions for any of the speakers or for Kat from the data today. Would somebody be willing to play Oprah and run a microphone? Do you? Okay. But we've got folks online too. So let me. Oh, thanks, Marvell. Right. Either
I
direction.
didn't realize I have to be on stage as well. Yeah, I have a question about where you see the opportunities actually for the funding. I mean, we talk about the intersectional funders. That seems a clear one. But also looking at funders that have decreased their funding, but also fund other things. Where do you see opportunities for us to leverage for more money?
Thank you. Yeah, I appreciate the question. I think funding for advocacy is a space that we know that leverage point can really be heightened. So that's something we're always drawing attention to. I think like Mason said, and like we heard so eloquently from Ali, like really helping other funders see the role that they play in this space is valuable. I think that we need to be clear about that HIV intersects with all of these other issue areas, right? Keeping funders in the game, I think, is a really important point and a really important opportunity, right? I think there are lots of ways that we can, even funders that are starting to shift their focus can continue to be engaged by understanding that HIV is still a racial justice issue. HIV is still an LGBTQ issue, right? Funders who have been in this field for a very long time are moving away towards these issue areas, which are still really, really vital intersectional points for funding. So I think helping to use our voices, philanthropy helping to use their voice and not just their money to speak to other funders, to like continue to share these really powerful things that we're hearing today. Collaborative pooled funds, I think, is another really, really important space where we know that funders can come together and have a lot more impact when and reach community. Another thing that we really want to try and do in the future is understand how the funding is reaching community-led organizations. And so thinking about how we can track that and bring that data forward so that funders can understand how to get that money directly to community-based organizations. And I think that's a really powerful opportunity, right? When we're funding directly to community, the impact of the work is much, much stronger. So anyone else have ideas? Those would be my thoughts.
Well said. I wanted to, any other questions, either online or in the room? I want to do a couple, yes, please.
Thanks. This was really, really helpful. I'm Colin with Results. And I wanted to pick up on the advocacy point. And Mason, at the start, you talked about how government funding, both at the domestic level and donor level, is decreasing. Ali and Jesse, you both made really compelling cases for advocacy. And I'm curious, and Kat, maybe this is like in the data somewhere, the extent to which funding for advocacy is connected to government resource mobilization as a part of that advocacy alongside policy change and doing both. And I'm asking a leading question. I work for an advocacy organization, but would love to hear your reflections on that. Thanks.
Definitely don't have the data to track that at this point. But I do think that, you know, I'm sure that there's lots of anecdotal evidence that folks in the room could bring forward about the power of funding advocacy to leverage. You know, I know that we saw PEPFAR authorization come through to some degree. We know how much effort went into that. And we know that philanthropy supported a lot of that work, but I think I could only bring forth anecdotal evidence myself, but.
I would say, so I've started to attend UNAIDS program coordinating board meetings periodically and talking with members of the NGO delegation. And I am struck by how many of them are using general operating support grants and advocacy grants to get themselves to Geneva to be in front of donor governments advocating for sustained and increased HIV funding. Oftentimes they're not supported by HIV project grants to do that. They're doing that because it's critical work. And they are finding a way to get themselves there, and they are not funded by UNAIDS to do it for the most part. So there's certainly a lot of advocacy that's going on at the community level, but there's significant advocacy going on, really trying to move donor governments and help them understand who's impacted, where they're from, and what's at stake. And we need more of that. Because we are at this point where we actually are seeing increased rising HIV rates in all regions, really, except for sub-Saharan Africa. So we're seeing more and more people becoming HIV positive. This is going to be a more expensive epidemic at the same time that finances are on the decline. That is a really dangerous combination and is really an issue of inequities. We are actually deciding on some level as donor governments, as funders, that it's okay to let certain people and places be negatively impacted, not benefit from all of the medical advances in our times. And that is not okay. Those are folks of color. Those are people in the global South. Those are LGBT people, sex workers, people who use drugs. We are leaving them behind, and there's no reason for it. So this is why I think this advocacy piece, to get people in front and telling their stories, to help people realize this may not be an issue that seems new and sexy these days, but it is here, and it is not leaving us unless we do something dramatically different.
I just want to add also, I'm so glad Jesse brought up the general operating support piece, and it's the one data point I forgot to mention in my report, but we saw a 60% increase in funding for general operating support. So really significant and a really bright spot that I missed, but thank you, Jesse, for saying.
Could I add one thing on budgetary advocacy? Because I understand your question to be specifically around budgetary advocacy. Is that right? So we don't specifically track it, but we're increasingly aware that our grantee partners are engaged in budgetary advocacy, which for US organizations is not subject to restrictions around like what's political lobbying versus what's just like C3 kind of advocacy work. So I'm thinking of US states where grantee partners are deeply involved in sort of state level budgetary processes successfully. I'm also thinking it's also happened in Mexico, in the different states in Mexico. But the example that I had referred to in Kenya, because that organization and others were deeply participating in the development of the AIDS framework, they had to say, like, we're here. So we're going to do censuses and surveys to show how many trans people are showing up at health clinics, at hospitals. We're going to give you numbers, and based on our numbers, and they did different types of surveying sampling techniques, they said, we need resources allocated to this population. And so it was a great use of like data to say, like, this is evidence-based. You say that you're concerned about key pops. Here we are. And now let's have the resources flow. And I think that this is kind of like, we don't pay enough attention to this. And I also think a lot of grantee partners would learn from it because it opens up the possibilities around advocacy. You're kind of saying, like, okay, you said this, but now commit money to it. And it's an important skill set to learn.
Thank you. One more and then we'll close it out. Thanks, Marvell.
Thank you very much, Masood of AIDS Foundation East West Supervisory Board. Just brilliant, excellent to see all very good data that can be used. I was wondering in terms of capacity building countries, because really the global one, you go for top donors, but at the country level, if the communities have more capacity to raise resources, do you have any tool that you can capture that kind of capacity of raising resources at the country level? And a little bit relevant to that one also in terms of Global Fund, I was wondering how you interact with Global Fund to build that capacity of the communities in the countries for raising resources.
Because we're looking strictly at philanthropic funding, we don't communicate much with Global Fund on that work, although we know that philanthropy is giving to Global Fund in a number of ways, and so it's something that we're exploring, tracking a little bit more on that side. We do have a field that we do track for capacity building and leadership development. It's a very broad category. So we look at philanthropic funding that's reaching organizations to help them internally do capacity building and to build leaders, whether within their own organizations or through the communities that they're supporting. But at the country level, I wouldn't say that we have anything that tracks that well, but I do have numbers on that capacity building, not on me, but I can definitely share those.
So we have a lot of data behind the data. So if you are a funder or an advocate and you want to know more about what does this look like in this country, or do you have additional disaggregated data, feel free to ask us. And if we can provide that, we will. I want to do a couple of recognitions before we close out because this kind of thing doesn't happen by itself. You've met Kat, who's done amazing work, as well as Sarah Hamilton, our Director of Operations. And our newest team member, Marvell Terry, our new Senior Manager of Programs, who was hired like a week ago and got on a plane right away to Munich. Thank you for doing that. And I want to thank American Jewish World Service, Broadway Cares Equity Fight AIDS, Gilead Sciences, and the Levi Strauss Foundation for helping underwrite the development of this report. It's by coming together as a field that we can make this happen and hopefully get this data into the hands of funders and activists to make the most of it. Thank you all for being here. Let's make some change together and change these numbers next year.